Good morning, everybody. Let me welcome you to the Finance Committee for Tuesday, April 22nd, 2025. Can I get a roll call, please?
Member Cahill, Member Childress, Member Covert,
Here.
Member Desart, Member Eckhoff, Member Evans, Member Galassi, Member Garcia,
Here.
Member Heather, Member Honig, Member Krajewski, Member LaPlante, Member Ozag, Member Rutledge, Member Schwarzy, Member Tornatori, Member Yu,
Here.
and Member Zay.
All right, thank you. I think we have a, gonna go with we have a quorum. Thank you. We're missing quite a few today. Okay, any public comment today? Public comment for today. Our chairwoman's remarks. I don't really have anything other than it's, so hopefully everybody had a fine Easter. Sympathy goes out to anyone who's Catholic and the loss of the Pope. Other than that, moving on to the meeting, can I get an approval of the minutes? A motion by Member Honig, second by Member Heather. All those in favor? Any opposed? Those are approved. Moving on to budget transfers, FIR 007425, budget transfers of 4/22/25, various companies and accounting units. Moved by Member Heather, second by Member Rutledge. Any discussion on these? All those in favor? Aye. Any opposed? Motion carries. Moving on to procurement requisitions. And we're going to give Member Schwarzy just a little bit of a second because we're already into human resources or human services for Member Schwarzy. That's where we're at already. But take your time. We'll just.
Thank you very much. Thank you very much. I move on item HSP 1625, recommendation for the approval of a contract purchase order to Central DuPage Hospital Association, doing business as Health Lab for patient phlebotomy and laboratory services for the DuPage Care Center for the period April 23rd, 2025 through April 22nd, 2026, for a total contract amount not to exceed $40,000. All right.
Second by Member Evans, right? A motion by Member Schwarzy, second by Member Evans. Any discussion on this one item? All those in favor?
Aye.
Any opposed? Motion carries.
Thank you. I move on HSP 1825, recommendation for the approval of a contract purchase order to McKesson Medical Surgical Government Solutions LLC to furnish and deliver incontinent products for the DuPage Care Center for the period June 30th, 25 through June 29th, 27 for a contract total amount not to exceed $200,000.
Motion by Member Schwarzy, second by Member Evans. Any discussion on this item? All those in favor?
Aye.
Aye. Any opposed? Motion carries.
Thank you. I move on HSP 1925, recommendation for the approval of a contract purchase order to Professional Medical and Surgical Supply Inc. to furnish and deliver ostomy, tracheostomy, urological and enteral supplies and services and enteral feeding formulas for the DuPage Care Center for the period July 30th, 25 through July 29th, 26 for a total contract not to exceed $50,000.
Motion by Member Schwarzy, second by Member Heather. Any discussion on this item? All those in favor?
Aye.
Any opposed? Motion carries.
Thank you. I move on HSR 1125, resolution to rescind HSP 1225 issued to Alco Sales and Service Company to provide Elite X long-term beds for the DuPage Care Center. Contract total amount of $109,192.16.
Motion by Member Schwarzy, second by Member Heather. Any discussion on this item? All those in favor?
Aye.
Any opposed? Motion carries.
Thank you. I move on HSP 2025, recommendation for the approval of a contract purchase order to Alco Sales and Services Co. for replacement of Elite X long-term beds for the DuPage Care Center for the period April 23rd, 25 through April 22nd, 26 for a contract amount not to exceed $110,880.
Okay, motion by Member Schwarzy, second by Member Yu. Any discussion on this item? All those in favor?
Aye.
Any opposed? Motion carries.
Thank you. I move on HSR 925, authorization to apply for program year 26 Title III Caregiver Resource Center Services Grant Funds from Age Guide Northeastern Illinois.
Got a motion by Member Schwarzy, second by Member Yu. Any discussion on this item? All those in favor?
Aye.
Any opposed? Motion carries.
Thank you. And finally, I move on HSR 1025, authorization to apply for FFY 2024 and FFY 2025, Section 5310 grant funds from the Regional Transportation Authority.
Motion by member Schwartz, second by member Galassi. Any discussion on this item? All those in favor? Aye. Any opposed? Motion carries. Thank you, member Schwartz. Now let's get settled. We'll move on to member Evans and Judicial and Public Safety.
Thank you, Madam Chair. I'd like to move on JPSC CO-3-25, amendment to purchase order 6219-1 serve issued to Colossus Inc. to increase the contract encumbrance in the amount of $12,527 for new contract total not to exceed $582,597.
We got a motion by member Evans, second by member Yu. Any discussion on this item? All those in favor?
Aye.
Any opposed? Motion carries.
Thank you, Madam Chair. I'd like to move on JPS CO-4-25, amendment to purchase order 7281-1 serve issued to AT&T Mobility LLC to increase the contract encumbrance in the amount of $75,000 for a new contract total not to exceed $479,000.
Yeah, motion by member Evans, I believe second by member Covert. Any discussion by this? All those in favor?
Aye.
Any opposed? Motion carries.
Thank you, Madam Chair. I'd like to move on JPS-CO-5-25, recommendation for the approval of an amendment to purchase order 7006-1 serve for a contract issued to Titan Image Group, Inc. for the purchase of printed business envelopes for various departments to increase the contract in the amount of $2,400 to include printing services, probation, and court services, resulting in an amended contract total not to exceed $44,655.
We got a motion by member Evans, second by member Yu. Is there any discussion on this item? All those in favor?
Aye.
Any opposed? Motion carries.
Thank you. I'd like to move on JPSP-20-25, recommendation for the approval of a contract to Peter M. King of King Holloway LLC to provide professional services as a child protection GAL attorney assigned to juvenile cases for the period of May 1st, 2025 through April 30th, 2026, for contract total amount not to exceed $42,000.
Got a motion by member Evans, second by member Heather. Any discussion on this item? All those in favor?
Aye.
Any opposed? Motion carries.
Thank you, Madam Chair. And finally, I'd like to move on JPSP-21-25, recommendation for the approval of a contract purchase order to Heartland Business Systems for the purchase of an intercom and access door system for the Sheriff's Office for the period of April 29th, 2025 through April 28th, 2028, for a contract total not to exceed $338,174.12.
A motion by member Evans, I believe a second by member Zay. Any discussion about this? All those in favor?
Aye.
Any opposed? Motion carries. Thank you, member Evans. Moving on to Public Works and member Childress.
Thank you, Madam Chair. I'd like to move on FMP 1925 on the recommendation for the approval of a contract to Enterwise Global Technologies for participation in demand response program for a period of June 1st, 2025 through May 31, 2026 for a contract not to exceed, for contract approximately $452,048.52.
We got a motion by member Childress, a second by member Covert. Any discussion on this item? All in favor? Any opposed? Motion carries. Thank you, member Children.
Thank you, Madam Chair. I'd like to move on FMP 2025, recommendation for the approval of a contract to Desmond Inc. to provide Phase 2 professional architectural and engineering design services to complete the repair, maintenance, and long-term capital improvement and asset management goals for the 479 and 509 parking decks on county campuses for the facilities management for a period of April 22, 2025 through November 30, 2029 for a total contract amount not to exceed $364,010.
A motion by member Childress, second by member Zay. Any discussion on this item? Member you?
Oh, I just had a quick question. So for phase one, was Desmond also the contractor that was handling phase one?
We'll have Tim Harbaugh, Director of Facilities, come up.
Right?
Yep.
Oh.
That is correct. Yes, the first amount of work we did was about $3 million and we have about $9 million remaining to get complete on the two decks.
Thank you. And is it just very typical that we always continue with the same contractor or vendor for another phase of a project?
It really depends on, a lot of times in a case like this, you're building on previous work. So we're replicating specs that were done in the past. They also have an institutional knowledge of the work they've done. In a case like this, it would have been significantly more money we would have lost with the institutional knowledge that Desmond had versus selecting someone else.
All right, thank you.
All right, thanks, Tim. Member Krajewski.
Institutional knowledge, is it the same people?
This is an engineering firm.
No, it's same people on the engineering firm.
That is correct, yes.
So the same
Yeah,
people.
and his name escapes me right now, but we've been working with. But actually what you're saying is correct. I have had cases where the institutional knowledge left to another firm.
Right.
And you're both your law firm and your accounting practices, right? Correct, it's there. Mhm.
Okay, so
Yeah.
the same people are. on
Yes,
it.
that is correct.
Thanks.
Okay, thank you, Member Krajewski. Anyone else? Okay, all those in favor? Aye. Any opposed? Motion carries.
Thank you, Madam Chair. I'd like to move on FMP 1525, the recommendation for the approval of a contract to Grout Inc. to provide refuse disposal, recycling, asbestos pickup services for DuPage County facility for the facilities management for a period of June 1, 2025 through May 31, 2026, for a contract total amount not to exceed $126,843.06.
Got a motion by Member Childers, second by Member Heather. Is there any discussion on this item? All those in favor? Any opposed? Motion carries.
Thank you, Madam Chair. I'd like to move on FMR 125 with the amendment to the resolution of FMP 1525 issued to Groot Industries for the refuse disposal, recycle, and asbestos pickup for facilities management, expanding the scope of the service to include the additional location for the health department, increasing the contract rate per pickup by 2%.
Got a motion by Member Childers, second by Member Heather. Any discussion on this item? All those in favor? Aye. Any opposed? Motion carries.
Thank you, Madam Chair. I'd like to move on PWP 725 with the recommendation for the approval of a contract purchase order to Groot Industries, Inc. to provide refuge pickup, recycling, and asbestos pickup for the DuPage County Public Works Facility for Public Works for a period of June 1, 2025 through May 31, 2026 for a contract total amount not to exceed $80,000.
Got a motion by Member Childers, second by Member Zay. Any discussion on this item? Member Rutledge?
Just a question. Thank you, Chair. Are we moving anywhere toward food scrap composting pickup? I'm not sure if that's a service that Groot's gonna offer, but you keep talking about it.
I can get back to you on the food scrapping. I mean, the food scrapping is not part of the group contract. And as you realize, there aren't that many of the haulers that do allow it. So we might have to do a separate contract if we move toward food scrapping. But we can definitely keep you updated on that.
Well, I'll keep asking the question. Thank you, Nickens.
And then just wanting to add on that, it's not available in the winter typically, because
Sure.
what happens is it goes from here. So you have the service 6 months out of the year. We still have to have the solid waste services and the volume of our containers to meet the winter load. So it's actually an increased cost. But what we are gonna do is, I anticipate this will be rebid next year, and we will put it in the bid specs for next year. And then the Public Works can make
See
a
how they
decision of how
respond.
they want to move on that.
Great. Because I know we have those great big composters over at the sheriff's.
We-
Oh, guard.
We're set up for it. It's just that winter window that makes it, that's where the hurdles lie.
Thank you, Tim.
All right, thank you for the question, Member Rutledge. Good question. Any other discussion on this? All those in favor? Aye. Any opposed? Motion carries.
Thank you, Madam Chair. I'd like to move on PWP 825, recommendation for the approval of a contract to the Chicagoland paving contractors for the parking lot rehabilitation at the Nordic wastewater treatment plant in Itasca for the softball complex for a period of April 22, 2025 through November 30, 2025, for a total contract amount not to exceed $99,000.
We've got a motion by member Childers, second by member Zay. Any discussion on this item? All those in favor? Aye. Any opposed? Motion carries.
Thank you, Madam Chair. I'd like to move on PWP 925 with the recommendation for the approval of a contract purchase order to Federal Signal Corporation doing business as Standard Equipment Company for a Vector 2100 Plus combination sewer cleaner for Public Works and Stormwater for a period of April 22, 2025 to April 21, 2026, for a total contract amount not to exceed $705,577.
Got a motion by member Childers, second by member Zay. Any discussions on this item? All those in favor? Aye. Any opposed? Motion carries.
Thank you, Madam Chair. I'd like to move on, the recommendation for the approval of a PWP 1025, for the recommendation for the approval of a contract to Rowell Chemical Corporation to provide sodium hypochlorite to the Woodridge Water Treatment Facilities Management and the Knollwood Water Treatment Facility for Public Works for a period of April 22, 2025 to April 31, 2026, for a contract total amount not to exceed $115,000.
Got a motion by member Childers, second by member Zay. Is there any discussion on this item? All those in favor? Aye. Any opposed? Motion carries.
And finally, thank you, Madam Chair. Finally, I'd like to move on PWR 325 on the amendment to the resolution on PWP 1025 issued to Royal Chemical Corporation to provide sodium hypochlorite to the Woodridge Water Treatment Facility and the Knollwood Wastewater Treatment Facility for Public Works. The contract rate is decreasing from $2.16 a gallon delivered to $2.10 per gallon, resulting in a decrease of 3%.
Okay, motion by member Childers, second by member Zay. Any discussion on this? I do want to say it's always glad to see when the price is going down. Always a good thing. All in favor? Aye. Any opposed? Motion carries. Thank you, member Childers. Moving on to transportation, in lieu of member Ozog's absence, I'm gonna hand this over to Vice Chair Tornatore.
Thank you, Madam Chair. With the leave of the chair and the body, I move to combine items 7D1 through 10. They're all amendments to resolutions.
Motion by member Tornatore to combine items 7D1 through 7D10, I believe, correct?
Yes, correct.
Okay, all those in favor? Any opposed? Okay, those motions are combined.
Thank you, Madam Chair. I move approval of 25-0835 DTR 387-820, an amendment to resolution DTR 387-20 issued to Brothers Asphalt Paving for the Addison Township Road Maintenance Program, section 20-1000-0M-GM, to decrease the funding in the amount of $57,895.97 and close the contract, resulting in a final township cost of $455,487.37, a decrease of 11.28%. Move approval of 25-0842 DTP 628-21, amendment to resolution DTP 62-22 issued to Atlas Engineering Group Limited for professional construction engineering services, section 21-CNGR-08-EG, to decrease the funding in the amount of $72,542.50, close the contract, resulting in a final county cost of $327,457.50, decrease of 18.14%. Move approval of 25-0849 DTR 2638-22, amendment to resolution DTR 263-22 issued to H&H Electric Company for LED traffic signal head replacements, section 22 TSUPG-06-GM, to decrease the funding in the amount of $1,879.02 and close the contract, resulting in a final county cost of $296,780.89, a decrease of 0.63%. Move approval of 25-0852 DTR 18A-19, amendment to resolution DTR 18-19, an intergovernmental agreement between the County of DuPage and the Village of Carroll Stream for improvements at the intersection of County Highway 36, Schmalley Road and Live Road, decrease the funding in the amount of $7,176.57. Close the contract, resulting in a final county cost of $9,164.33, a decrease of 43.92%. Move approval of 25-0853 DTR 158B-21, amendment to resolution DTR 158A-21 and DTR 158-21, issued to Copenhagen Construction for the 2021 Sidewalk Improvements Program, Section 19, SDW LK-04-SW, decrease the funding in the amount of $23,007.28 and close the contract, resulting in a final county cost of $192,452.63, a decrease of 10.68%. Move approval of 25-0954 DTR 428B-21, amendment to resolution DTR 428A-21, issued to R.W. Duttman Company for the Downers Grove Township 2021 Resurfacing Program, Section 21 3000-01-GM, to decrease the funding in the amount of $201,457.17 and close the contract, resulting in a final township cost of $464,431.87, decrease of 30.25%. Move approval of 25-1009 DTR 61A-23, an amendment to resolution DTR 61-23, issued to R.W. Duttman Company for the 2023 Pavement Maintenance North Program, Section 23-PVMTC-19-GM, to increase the funding in the amount of $150,610.95, plus 2.39%, resulting in an amended contract total amount of $6,438,910.95, plus 2.39%. I assume that's an increase. Move approval of 25-1015 DTR 59A-23, an amendment to resolution DTR 59-23 for the 2023 Pavement Maintenance Central Program, issued to R.W. Duttman Company, to decrease the funding in the amount of $64,083.93, minus 1.55%, close the contract, resulting in a final county cost of $4,073,916.07. Move approval of 25-1019 DTR 173B-22, an amendment to resolution DTR 178-22, issued to R.W. Duttman Company for the 2022 Pavement Maintenance North Program, Section 22 PVMTC-17-GM, to decrease the funding in the amount of $48,327.51 to close the contract, resulting in a final county cost of $5,565,176.49, a decrease of 0.86%, and a final cumulative increase of 3.28%. Move approval of 25-1027 DTR 172D-22, an amendment to resolution DTR 172C-22, issued to K5 Construction for the 2022 Pavement Maintenance South Program, Section 22 PVMTC-18-GM, to decrease the funding in the amount of $311,588.42, close the contract, resulting in a final county cost of $4,635,800.17, a decrease of 6.3%, and a cumulative decrease of 1.31%.
We've got a motion by member Tornatore, second by member Heather on all of those items. Good job reading. Any discussion on any of these items? Okay, all those in favor? Aye. Any opposed? All those motions pass. Moving on to D.11.
Madam Chair, I move to combine item 7D11 through D14 using contract approvals.
Got a motion by member Tornatore, second by member Galassi. All those in favor? Any opposed?
Thank you,
Those
Madam Chair.
items are combined.
With DTP 25-25, a recommendation for the approval of a contract to Northern Contracting Inc. furnish, deliver, repair, and install guardrails as needed for the Division of Transportation for the period May 12, 2025 through April 30, 2026, for a contract total not to exceed $75,000. The lowest responsible bid, item 25-03I-DOT, Move approval of DTP 26-25, a recommendation for the approval of contract with Haggerty Ford Inc. Furnish and deliver Ford Motorcraft repair and replacement parts as needed for the Division of Transportation for the period June 1, 2025 through May 31st, 2026. For contract total not to exceed $100,000 for lowest responsible bid number 24-039-20-DOT, first of three renewals. Move approval of DTP 27-25. Recommendation for the approval of the contract to C Orbit Group Inc. to provide professional construction engineering services for the 2025 payment maintenance south program, section 25-PBM-TC-25-GM for the period April 22, 25 through June 30th, 2026 for the contract total not to exceed $471,773. Professional services vetted through a qualification-based selection process in compliance with the Local Government Professional Services Selection Act. Move approval of DTP 28-25, a recommendation for the approval of contract Primera Engineers Limited to provide professional construction engineering services for the 2025 payment maintenance north program, section 25 PBM2C-24-GM for the period April 22, 25 through June 30th, 26 for a contract total not to exceed $535,843. Professional services vetted through a qualification-based selection process in compliance with the Local Government Professional Services Selection Act.
Yeah, we've got a motion by member Torritori, a second by member Galassi. Oh, wasn't her, okay. I'm sorry. Oh, okay, okay, sorry. Member Zay, second by member Zay. Thank you. Any discussion on any of these items? All those in favor? Aye. Any opposed? Motion carries.
Thank you, Madam Chair. I move to combine items 7B15 through 18. These are all awarding resolutions.
Okay. Got a motion by member Torritori, second by member Galassi on this one. And all those in favor? Aye. Any opposed? Those are combined.
Thank you, Madam Chair. I move approval of DTR 5-25, an awarding resolution to Geneva Construction Company, the Winfield Township Liberty Street Resurfacing Project, section 25 8000-01 RS, estimated township cost $116,579.57. No county cost per lowest responsible bid. Move approval of DTR 6-25, an awarding resolution to Trigger Construction Inc. for the 2025 Sidewalk Improvements Program, section 23 STWLK-07-SW for an estimated county cost of $985,127.30. The lowest responsible bid. Move approval of DTR 7-25, an awarding resolution to K5 Construction Company Corporation for the 2025 payment maintenance south program, section 25 PBM-TC-25-GM for an estimated county cost of $7,150,125.82 for lowest responsible bid. And finally, move approval of DTR 8-25, an awarding resolution to Builders Paving LLC for the 2025 payment maintenance north program, section 25 PBM-TC-24-GM for an estimated county cost of $7,524,912.96 for lowest responsible bid.
Got a motion by member Torritori and a second by member Heather. Any discussion on these items? All those in favor? Aye. Any opposed? Motion carries and it welcome construction season. Happy spring. Okay, moving on to finance resolutions and I turn to Vice Chair Cahill.
Thank you, Madam Chair. I move to approve FIO 1-25 amendment to the GIS fee Informational Technology GIS Division.
Motion by member Cahill, second by member Rutledge. Any discussion on this item? I know we had a big discussion about this already. Is there any other further discussion? No. Okay. All those in favor? Aye. Any opposed? Motion carries.
Thank you, Madam Chair. I move to approve FIR 6525, recommendation for approval of modification 1 to home agreement HM 21-02A between Catholic Charities Diocese of Joliet, Inc. and the County of DuPage, increasing the amount of home funding by $110,339 for a total home amount of $410,339.
A motion by member Cahill, second by member Heather. No, I'm sorry. Member LaPlante. I'm sorry. Member LaPlante. We've got a question, I believe, member Eckhoff.
I just had a question. This grant looks like it's servicing or helping 13 families. But how are we off by a third and those Catholic charities kicking in any additional money to make up the difference?
This is for additional time to carry the program forward. It's not an increase from the same period of time.
Okay, and we're using future grant money for it
No, we've already received these home funds.
through 2025?
Yes.
Through this year?
Well, yes, we're using prior year home funds. The home program funding, you have 7 years to expend it. So we're just extending, we're using funds that we've already had allocated. We're not at any risk of not receiving these funds.
I just was surprised they went up by a third.
It's like I said, it's an
extending.
extension to bring them through, I think, September. I will get back to you before county board to make sure that my
I just didn't
information
know
is
why
correct.
it didn't go through September or November or whatever before.
Rent increases have something to do with it. So the families that are being assisted, the rents are higher.
Okay. Thank you.
Okay, thank you, Member Eckhoff. Any other discussion on this item? All those in favor?
Aye.
Any opposed? Motion carries.
Thank you. I move to approve FIR 66-25, additional appropriation for the DuPage Care Center Foundation Funded Projects Fund, Company 1200, Unit 2105, in the amount of $21,112, DuPage Care Center.
Motion Member Cahill, second by Member Yu. Any discussion on this item? All those in favor? Aye. Any opposed? Motion carries.
Thank you. I move to approve FIR 67-25, additional appropriation for the Help America Vote Act Polling Place Accessibility Grant Program Year 25, Company 5000, Accounting Unit 1071, in the amount of $668,448, County Clerk Election Division.
A motion Member Cahill, second Member Galassi, a question by Member Eckhoff.
I had a question on D and E, because the attachment says that there's contractual services or grant services. Do we have designated projects that are being funded by these two amounts?
Do we have anyone from the clerk's office online
Off the staff.
or here?
Maybe we can find out before, because if the money's not specifically designated for specific projects, I wondered where the money was going and who had control over how it was expended, because I didn't want a situation where there's money in the bank at the end of the year and we give out another 37 bonuses to people.
I
We can
don't
find
think
out
we can do
before
that
the-
with grant money. I don't know if that's a question for our finance department, but I believe that grant money has to be spent on what it's actually allocated for.
Well, that's why I'm wondering why we don't have specific projects for it now.
I know in the last, I believe they said they were making the polling places more accessible by parking places handicapped and
Yeah,
things
there's
like
one
that.
for
So
Whedon Park District, but it doesn't say that in the attachment.
So to answer your specific question regarding the use of the funds, they can't be used to give out increases. The money, when we receive the grant funds, they go into the grant, specific grant funds, not the general fund. So they can't be used for those
Well, I'm
type of
just,
expenses. But I'm not sure
don't know
the
what the projects
specifics.
are.
Okay.
You guys just told me after the meeting, but what?
Okay. It's a reimbursement-based grant, but I'm not sure the specifics of what the
All right.
expenditures
So
are.
just let me know before the county board
I'll
meeting,
try.
if you can.
Okay.
All right,
as
thank
a
you.
reimbursement grant, they have to spend it on what they actually said they were going to spend it on to get the money, correct?
We'd have to look at the grant agreement, but that's probably the
I mean,
case.
that's how our grants are. So
What I
that's
can do
what
is check with our grant manager.
before the
and
county
look at
board.
Yeah.
Perfect. Thank you, Jeff. Any other discussions on this item? All those in favor? Aye. Any opposed? Motion carries.
Thank you. I move to approve FIR 68-25, additional appropriation for the Illinois Voter Registration Systems Grant Program Year 25, Company 5000, Accounting Unit 4250, in the amount of $848,376, County Clerk Election Division.
Got a motion, Member Cahill. Who was the second? Member Schwarzy. All those in favor, any discussion? All those in favor? Aye. Any opposed? Motion carries.
Thank you. I move on FIR 69-25, acceptance and appropriation of interest earned on investment for the DuPage Animal Friends Phase 2 Capital Project Grant, Company 5,000, Accounting Unit 1310, in the amount of $12,070, Animal Services.
And a motion by member Cahill, second by member Yu. Any discussion on this? All those in favor? Aye. Any opposed? Motion carries.
Thank you, Madam Chair. I move on approval FIR 71-25, additional appropriation for the Tort Liability Fund, Company 1100, Accounting Unit 1212, in the amount of $10 million.
A motion by member Cahill, second by member Zay, and I know we do have Lisa and Jeff to explain this item before we take questions.
Just to give a quick background on this, there was $10 million that was transferred from the general fund to the tort liability fund. That came out of the 2024 surplus. There's a substantial claim now that is most likely getting ready to be paid out. We've talked about that before. So this is just the money now to appropriate or expense that claim for this dollar amount.
Okay. Lisa?
And just a quick detail, that case has not been, the matter that this agenda item refers to has not been completely settled. A minor settlement will be before the court on May 22nd. So for that reason, we would ask that any factual discussions about the case that you may have be not done in open session.
Okay. We have one question by member Desart.
Thank you, and thank you for that additional information, because I was wondering why there was nothing in the board packet. You know, the money wasn't specifically designated for anything, so how much, Jeff, how much money has the county put into our tort fund in the last 2 years? Because it seems like every quarter or so we put in another 10.
Well, yeah.
I'm sorry.
This is the same
Jeff
amount.
The question. How much have we put into the tort account in the last 2 years?
This was a separate special transfer that we did back in October.
No, that's fine. I'm wondering
I
how much we
think-
put into the tort account.
I'd have to get you that dollar amount.
Ballpark?
With this claim,
Sure.
let's see, including the transfer from the general fund, any property taxes received that need to be transferred in. I would say in 2024, there was between 15 and 17 million. On
17.
a normal year, we'd probably put in $6 to $7 million.
Okay, thank you. So, so this year it's been 17 million. So,
This particular 10 million is
Yeah.
for 2024.
for 2024, so this 10 million is for 2024. And so it doesn't include, and I'm not breaking any rules by saying this because it was in the paper, this doesn't include the $11 million.
It does.
Oh, it does include the $11 million.
Yes, this is
17.
specifically to pay that claim.
Okay, so what if I said, and I'm just playing devil's advocate here, what if I said that the people who are Renata's family, it was in the paper, we put forth 11 and they haven't agreed to it yet. And now is this an additional 10 million? So now that Renata's family can say, oh, they're putting more money into the account?
No,
So basically, this is a clarification on this. Basically, we're taking it from a savings account to a checking account. So we're basically, it's the same $10 million that we put aside from 2024. We're just moving it to like a checking account so we could write a check. That's basically the simplest way to put it, correct?
And
Yes,
was this money, was this $10 million in the 2025 general fund budget?
no, we're.
2024 federal fund? I'm sorry?
2024.
I'm hearing an awful lot of chatter out here, and I'd really like to have a conversation with just Jeff. It was in the 2024 budget?
It will be now, once this budget transfer or
All right.
budget appropriation is approved.
All right, thank you, Madam Chair.
You're welcome.
I would ask that people be quiet when I'm trying to listen to the experts speak.
Member Krajewski.
Thanks. Jeff, this board could put $25 million in there tomorrow. And next year we could put 40 million in there and we could take 15 out of there. It means nothing, right? We could do what we want with the money. If we want to know about a tort liability and what that's for liability, we could go to our financial statements in the footnotes every year when we have to disclose
what our actual liabilities are projected to be. You get letters from the attorney or from a Baker Tilly asking you, what's the likelihood on every single case that's out there? We build reserves up for that. And so that is what means something, is what's in those financial statements every year that is disclosed to everybody in the, universe. But us putting money in means absolutely nothing. We could take tomorrow and decide to put 50 million in there if we wanted to, and then next day we could take it out. But the biggest thing, if we're looking at what potential liabilities are, is to look at what our financial statement says at the end of the year and what the projected liability says. We have to give that to Baker Tilly, do we not?
Yes, we do. Yes, they audit all of that. And in this case, we worked with Baker Tilly for this specific claim. Because of the dollar amount and when it started to come to fruition, they wanted it back to 2024. We
Right, and
verified
they
it.
put a footnote in, I'm
They're-
sure.
they're- yeah, They
Yeah.
probably will.
Yeah, it's gonna be in our financial statement.
Yes.
It'll show what that is, but that's kind of what our best guess really liability is. It has nothing to do with how much money we throw in a pot of funds. That means absolutely nothing. But what that's in that financial statement is what actually is probably going to be the ultimate total that we're going to be liable for.
Yes.
Thank you.
Okay, any other discussions on this item? All those in, yeah, go ahead, sure.
I just wanted to clarify that the terms of the settlement have been set. They merely need to be approved by the court. So that's why the matter is not finally concluded. So that's what we're waiting for.
All right, thank you, Lisa. Any other discussion on this then? Okay, all those in favor? Aye. Any opposed? Motion carries.
Thank you. I move for approval on FIR 73-25, approval of employee compensation and job classification adjustments, community services.
A motion by member Cahill, second by member Heather. Any discussion on this item? All those in favor? Aye. Any opposed? Motion carries.
Thank you. I move to approve FIR 75-25, approval employee compensation and job classification adjustments, stormwater.
A motion by member Cahill, second by member Honig. Any discussion on this item? All those in favor? Aye. Any opposed? Motion carries.
Thank you. I move to approve FIR 76-25, approval of employee compensation and job classification adjustments, public works.
Motion by member Cahill, second by member Rutledge. Any discussion? All those in favor? Aye. Any opposed? Motion carries.
Thank you. I move to approve FIR 77-25, appointment of Laura Flamion as Animal Service Administrator and Dr. Kristen Turvidick as Animal Service Deputy Administrator, Animal Services.
Got a motion by member Cahill, second by member Desart. Any discussion on this item? Other than what I say, couldn't pick a better choice. All those in favor?
Aye.
Aye. Any opposed? Motion carries.
Great, thank you. I move for approval on FIR 78-25, revision to personal policy manual, parental time policy, human resources.
Got a motion by member Cahill, second by member Rutledge. Any discussion on this item? I know we have a couple of people this is going to affect. Member Yu.
Thank you, Madam Chair. So I was looking at the one provision on page 1 of the parental policy, and I was just wondering if there was a typo or an error. Because it says all full-time and part-time employees who are budgeted to work a minimum of 20 hours per week and have worked at least 1,250 hours. And it goes directly into 12 months are eligible to receive up to 12 work weeks of parental time. So I feel like there might have been something missing there.
Nick, come in. I think there's a word "or" missing, probably.
What we'll do, if it's okay, we'll work with you to make sure in between. And if we do to make a change, we'll bring it to county board.
Okay, thank you.
Okay.
Thank you for pointing that out. We'll get that corrected because it should have an "or" in there. Okay, any other discussion on this item? All those in favor? Aye. Any opposed? Motion carries. Okay, Vice Chair Cahill.
Thank you. Informational. I move to receive and place on file payment of claims, wire transfers, county board resolutions, and grant proposal notifications.
Motion by member Cahill, second by member Heather. Is there any discussion on any of these items? All those in favor? Aye. Any opposed? Okay, those are all received and placed on file. And then we're gonna go to our presentation and we're gonna have Janelle Chadwick come up and give us a presentation on the Care Center construction update and East Wing build out program.
Good morning. I want to talk with you today about our construction, where we're at now, update, and also the East Building design and funding. So if you recall, the Care Center building renovation approval was originally at November 9th of 2022. And we amended the contract and reduced that on November 26th of 24 down to $30,900,000. This just is a recall. Next slide. So to talk about the Care Center needs being met, so our resident care renovation construction, we're 3 North is done and the residents were moved up within the last 2 weeks. 3 Center is our special care unit, dementia unit. That unit has been surveyed by the architect and we're waiting for the clinical nurse from IDPH to come. I'm hoping she arrives today or anytime. Common area renovations. So we did lighting and finish upgrades on 3 South, ground south and ground east common areas. Again, we're just doing corridors in those areas, not offices. Wayfinding improvement, maybe you've seen it. We have some excellent signage that's been put on the Care Center. So now people know we're not an office building and we actually provide care to seniors. So we're really thrilled with that. Next slide. We all love the fluorescent orange floor. We're really glad that that's gone. So you can see that is 3 North. It's currently occupied now. Next slide. So this is again 3 North. It shows you the resident rooms, the old on the left, obviously, and the right. And I just want to mention that is staged for an IDPH survey. So we have to have specific equipment in there. So there's no fancy stuff or blankets or anything. It's just for that purpose. The other thing I want to mention is those windows are all new in our building and they have blinds within the glass. So it's a really great feature. We're very proud of those windows. I'm very happy that we have them for safety in the wind tolerance should there be a tornado. Next slide. And this is one of my favorite remodels so far. This is the dementia unit. If you see in the left, the window panes there was actually an exterior porch that was there. And it was just kind of odd because there was no glass above or below. And who knows if people could fall over it. But you can see on the other side, we were able to remove all of that and put in a nice solid surface there. We like the separation because sometimes you want a calmer area for someone who's having some behaviors and you can bring them to that side where we have a fireplace that'll go on the wall. And it's just a more calm area. So we like those separations of space, but it just allows so much more room for everyone to roam. And we're really excited to get back to this unit. Next slide. So this is the nurses station on this unit. You can see the wall that was there on the left. Really by regulation, you should be able to see that area very clearly with the dementia patients. So if there's something going on and the nurse is charting or on the phone with a physician, they really had a barrier. So removing that wall was essential. And I would be surprised if the architect wouldn't have had an issue since we did do a renovation if we had left that, or at least maybe the nurse, clinical nurse. Interestingly enough, we could not remove the entire wall. Behind there was old, I don't know what year, 1930s maybe. It was an exterior window brick arch. It was really interesting to see that behind that wall. So it's still there in some elements, but we now opened it up so the nursing staff can really have great oversight of the unit as a whole. Here is a dementia room. We have cabinets with locks on them. So when there's nursing, we have to keep anything that says keep out of reach of children. We have to put it behind lock. So each room will have a drawer that locks. The rest we open to the resident themselves. Also in this room, there are different things we had to pay attention to, like the medicine cabinets were original glass. And if they broke, they would be shards of glass. So these are now, the medicine cabinets will be, the mirrors will be like your car glass where it crumbles into pieces. So We really were able to put a lot of thought and safety features on this unit. And like I said, this is the one I'm most excited to occupy. Next, please. That is the nursing and finance administrative corridor, just showing you how we did the corridors. Next is the ground south. That's where you come in by the gift shop, and that leads to our conference rooms. And this is down by the conference rooms. We are redoing just paint and flooring in the dividers in the conference rooms. We have really nice large conference rooms, and IDPH used to hold quarterly meetings at facilities, a coordinated facility and IDPH surveyor meetings, which were really beneficial because we all heard the same message and we kind of knew their guidance and their perspective on how they were going to survey us. They got away from that, but now they're coming back. And Care Center was always a key location. So I'm hoping once we get these done, that we'll be able to bring those meetings back to this space. Next slide, you can see some of the signage, not in its completed state, but almost. It's just been a big benefit so people know where to go. But that's an example. And the other biggest impact, I think, is you can see the before and after of the entrance to the facility. This is the primary entrance, and I think it looks very stately, and I'm very proud of it. And the staff are very proud of it. It makes them happy to come to work there. And it's a great, much improved for marketing purposes as well. Is this your area, Tim?
Morning, everyone. What we did is the work that's been completed is phase one, as you can show on here. And then if you go to the next slide, phase two is the east building. And that's really what I talked about today, the east building and some recommendations, ideas for the committee and with your consensus, how we'd like to proceed. So from there, next slide. I want to get you a little history as to where we came to today and how we want to move ahead. We went on the street to do the reconstruction of the east building. We had 7 proposals in. We interviewed 3 firms. If we were to move ahead with this with your concurrence, we would like to move with White Construction, a White & Company. At the conclusion of this, if you concur with staff, on May 6th, we'd like to come to the Human Services Committee with a architectural contract for 75% of the design. The reason we're doing 75% of the design is we want to move ahead with the construction manager at risk proposal. In order to do that, they've got to get the design of the majority of the way done so they can crank down their numbers. All the variables we have, the fixtures they want, et cetera, has to be incorporated in that to get that price. Then from there, on August 19th, going to Human Services Committee, we would be moving ahead with the construction contract through the remainder of the 75% construction and then the build out. The build out would start in July of 2026. The current phase one work would be done in June of 2026. Would be kind of a seamless flow. And then we'd talk about 13 months to complete that construction. A few things I want to go through that's kind of important. First, the next slide, sorry, jumping ahead on you. I don't want to spend a lot of time on all the details, but this is all the pieces that we want to put together to complete this work. This will be about $16.9 million. Nick is going to go through the funding on that. This will be funded by the Care Center, but Nick's going to spend a lot more time on that. Last that I had before I hand over to Nick is, this is an important one for you. Between bidding all this work and everything, we would not start to expend this money until about February of 2027. So if for any reason we needed to pull back this project, that could be done between now and February of 2027. So the lion's share of the expenses would be the construction, between variables in DC, potential variables with the funding that Janelle has, some other pieces in there. We think that's a very comfortable safety net for you to consider as you move ahead. So from there, the last slide will be done by Nick.
Good morning again. So a little bit of a background. I just want to back up. So to this point, the team has, with the guidance from the board, we've completed the other phases, or getting close to completing the other phases, and they've gone extremely well. The only building left over there for the residents that haven't been touched is the east building. And so what our proposal today is, we want to continue the project to finish all the resident areas to get those lined out. And I know the team kind of went through how it would be done. I want to go through some specifics here. First of all, it's a $17 million project. It's a big component of it, but the Care Center has those reserves. So it would not touch the general fund. They have 31 million in reserves in the Care Center. So that would be entirely out of there. This was anticipated. I mean, we've been very lucky with the reserves in the care center increasing to this point. And from our standpoint, the time is now. We have the teams in place, we have the process in place, we have the permitting in place. We know how to do it. The building is very, very difficult. And what we want to do is move forward and get this area that we're touching. I think the last time it was renovated was in the 80s, if I remember correctly. 80s, early 90s. So it's been quite a while. We want to do the same thing to that building as we did to the other ones. So as we talked about, our plan would be to move forward with a 75% design contract to HS in probably the next month. And then once we get that going and we can develop the GMP contract for the full construction costs and remaining 25%, we would probably take it for approval in August, maybe September at the latest. As I said before, 100% of this project we paid for out of care center reserves, the 17 million. Now, the one thing, and we've had a lot of discussions on that, there's a lot of questions on federal funding. What's going to happen on federal funding? Medicare, Medicaid, what's going on? And that's been programmed in how we're doing it, because we know that the design is something we need. It's going to be designed. If for some reason on the federal level, our funding changes, it decreases, we have almost a year to pull out of this plan moving forward. We will have a good handle by the end of this year whether funding changes dramatically on a federal level. Like I said, we have a significant amount of money in reserves in care center, 31 million. And it's continuing to grow. That 31 million was back in November and ended November. So it's actually probably a little bit higher than that. But if the dynamics change, we may come back to you and say, we want to pause this. But we'll know by the end of this year. Really, our point of not really no return, but our point where we really got to make a decision is February of next year. That's where we will likely start construction and move forward. Because what we want to do is we want to segue from the projects going on right now, right into the next project. We do not want a gap. It will cost us more. It will be more difficult. The time is now. But if for some reason we have to start using the reserves to operate, well, then this will go on the back seat for sure. So how we want to do it, because of the uncertainty, we're going to make it, if the board concurs today to move forward with this, we will put an extra added safeguard in there that Janelle herself, as the care center executive director, has to approve moving forward once we get the contracts through here. She has probably the best handle on the funds there, what's happening. And it could be that maybe she gets halfway through and the phases, then something happens on the federal level, she can stop it at that point. And that's, we're going to build that in. So at that, we'll open up for any questions. We have nothing on the agenda today. We just wanted to have this discussion, and if there's concurrence, then we'll move forward accordingly.
Yeah, first I have Member Gale.
Yes, thank you, Madam Chair. I really support this fully. And I think the most important thing you stated is the economies of scale. And that is the key thing, moving the project along right now, as long as you have the team in place, the architects, the designers, everything. So I would 100% support.
Okay, Member LaPlante.
Thank you. I have a question. Nick, can you please walk us through how you are saying that you'll know by the end of the year if the funds are available and if things are shifting? Can you walk us through how you're going to know that?
So the only thing I will say is obviously things are changing radically, right? All I can say is we are keeping a handle on it. And if anything does change by the end of the year, we'll know. Is there something that could change in 26 or 27 or 28, 29? Absolutely, it could. I can only do with the information I have, which I will know exactly what our reserves are at the end of this year. I will know what the federal landscape is with Medicare, Medicaid reimbursement. I mean, like I said, we're 31 as of November, which it's likely higher than that. We'll at least know what's happening. You have a new federal budget cycle. You'll get a handle on that then as well. So we're keeping our eyes on it. I mean, can something change on us partway through next year? Absolutely.
Yeah, I think we should just be really careful with our language and using terms like we will know for sure, because we're not going to know anything for
It-
sure. Everything's going to be changing constantly. We can know to the
Month
best
by
of our
month, day
ability.
by day.
Right.
That's what we do.
Exactly,
That
exactly.
Medicare's going up by 2.8% for 2026.
Yeah, yeah.
And as I'm a board of director member for Leading Age
Mm-hmm.
Illinois, they have a very strong national Leading Age as well, and very involved with lobbyists. I was on a call just last week with Matt Warner. Matt Warner was very involved and worked with public aid, and so he's keeping us abreast of what we can potentially expect. So we got the right people in the right place to get that information timely.
Thank you. That really helps. Thank you for that information.
Thank you. Member Desart?
Thank you. This is the second time I've seen the presentation. We saw it at HS as well. And I don't have a question. I just want to say, not only do I concur, but I'm so excited about this project for our staff, for our residents. You know, we're part of the way in there, most of the way in there. Let's finish it up and really make this the gem that it is. So I concur, and I'm excited to finish the project. Thank you.
To that point, and this board took a chance with a lot of ARPA funds to do the first round. I will tell you the impact that you had to the residents over there and the joy that they've expressed for the new areas, the new rooms. I mean, it's definitely one of the best projects we did during ARPA. And I mean, it's made a world of difference over there.
Thank you. Member Schwarzy?
Thank you. I just wanted to share with this committee that they presented this at our Human Services Committee last week, and we were unanimously in support of going through with this. And what hasn't been said yet is this potentially has the ability to bring in more residents, which will help offset some of the funding, and maybe in the long term even break even on that. But the work that has been done at the care center, making it number 3 in the state, has just been amazing. And this is just going to keep that good work up. So thank you.
Also, we are down 3 units right now. So our census is low, but because we're still waiting for 3 Center to open, technically we're down 3 units for construction.
And can I ask, how many people is that approximately?
What is our current census, or what are we down? Our current census is right around 200. It's been running around 200, where we used to run 322 pre-COVID. And so we're down 110, probably about 115 beds.
Okay.
Right now, and we have 2 units.
That's kind of the amazing.
Sorry, that was wrong. Am I adding in my head? So it's 2 south, 2 north, and 3 center. So it's actually closer to just under 100 beds.
Okay.
And that's the amazing thing too. Janelle has managed to increase that reserve, even though our census, our bed count has been down artificially. I mean, because of COVID and then construction, we've had to keep it down. Once we get all these rooms done, I mean, it's a five-star facility. Now it will look like a 5-star facility.
Yeah, Member Heather?
Thank you, Madam Chair. Thank you, Janelle. Thank you, Tim, for a wonderful presentation. Could you elaborate a little bit more on when the construction happens? How are you going to manage residents being there and just all of that? And I know you may not have all the details right now,
Right.
but just a little bit if you can elaborate on that.
Right,
Thank
so
you.
as we were able to clear out 1 floor totally. We originally, when we started talking about construction, it was trying to clear a hall or 2 halls, which would have really impeded construction efficiency and increased cost drastically. So we were able to clear out total units at one time, so 56 bed unit. And then when that's complete, we started with 4. So then we moved, it's the exact same footprint. We moved the residents and the staff from 3 up to 4 when it's done. Then we did 3. When 3 is done, we moved the residents and staff right up to 3. And then we're now on 2 and 2 south.
Thank you. So you already have it figured out.
We have, yeah.
Glad to hear that.
Yes.
Thank you.
One thing to add, this was your largest ARPA project. The ARPA funds must be expended by the end of 26. So this will be done July of 26, because we will not get anywhere near close to that deadline because the funds go back. So that will be met. We promise you that.
Thank you.
Good news. Okay. I am sensing that this is going to be a good consensus, but let me take a vote. Are we all in consensus of this project going forward? Raise your hand, please. Okay. I have unanimous consensus for this to go forward. Thank you so much for the presentation, Janelle. Okay, I am told, do we have executive? Okay, but first we have old business. Any old business today? Any new business? Okay, so we do have executive session today, so pursuant to Open Meetings Act ILCS, we're going to do a review of executive session minutes. Can I get a motion to move to executive session? Member Heather, second by Member Evans. All those in favor? Aye. I roll call? Oh, sorry, I need a roll call.
All right. Member Cahill. Yes. Childress. Member Covert. Member Desart. Member Eckhoff. Member Evans. Member Galassi. Member Garcia.
Aye.
Member Heather. Member Honig. Member Krajewski. Member LaPlante. Member Ozag. Member Rutledge. Member Schwarzy. Member Tornatori. Member Yu.
Here.
And Member Zay.
Okay, let me know when we're in executive session.